Hey everyone, welcome back. Let's discuss histamine intolerance. This is something that affects 30 to 50% of people with digestive symptoms, according to the Canadian Journal of Gastroenterology and Hepatology. Now, it's not to say that if you don't have digestive symptoms, then you don't have histamine intolerance. But knowing that a fair subset of our audience cares about and is concerned about their gut health and how this is the root cause of many symptoms, I wanted to make sure to tie in how important your gut health is for impacting histamine intolerance. So today, let's go over the main symptoms in brief: digestive, bloating, diarrhea, abdominal pain, neurological, brain fog, depression, anxiety, insomnia, fatigue, skin, hives, rashing, respiratory, a runny nose, cardiovascular, heart palpitations. We'll detail those more in a moment. Then also discuss testing, and conveniently that, in my opinion, and I'll share the evidence that supports this, the most accurate way to test is actually a home test. And then a few of the factors and treatments that underlie histamine intolerance. To kick us off, what is histamine? It's a signaling molecule of the immune system. So you've likely yourself, or maybe you know a friend or a loved one who has allergies and they use an antihistamine. And this is because the immune system uses a number of inflammatory mediators, one of which is histamine as part of the immune process. And to tie in the gut, and this is actually from the journal Gut, we've modified it slightly, this visual, but this gives you a good portrayal of how important your digestive health is for healthy levels of histamine. So on the left side, what you're seeing is a healthy gut lining, a healthy microbiota, the world of bacteria in your intestinal tract, and how this leads to healthy activity of one of the sources of histamine, your mast cells. You may have heard of mast cell activation syndrome. I look at mast cell activation syndrome, or MCAS, and histamine intolerance as similar ways of describing essentially the same thing. There's nuanced differences, but I think for all intensive purposes, for clinical purposes, they're the same thing. Now, on the other side of this diagram, what you're seeing is a damaged gut lining where there's leaky gut and there's dysbiosis. This leads to triggering of the mast cell with increased production of histamine. Now, the other thing that I should tie into this directly is that the intestinal lining secretes an enzyme known as DAO, diamine oxidase, that metabolizes histamine. So this is one of the main sources of histamine intolerance, or histamine levels being high, along with the fact that when you have an overgrowth or dysbiosis in the gut, those disruptions actively produce histamine in and of themselves. So it's kind of a double whammy in that damaged gut lining will lead to lower levels of the enzymes that break down histamine. And then part of what causes that damage, fungal overgrowth, bacterial overgrowth, can in and of themselves either lead to triggering of more histamine release or produce histamine as a byproduct of their metabolism. So huge implications and opportunities for us to improve this if we modify and make more healthy your gut. And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health, so it is quite deeply appreciated. Like many things, the symptoms here are multi-system. And this is because, and as you're also seeing in this diagram, histamine receptors are speckled throughout your entire body. The brain, the thymus, the heart, immune cells, epithelial cells, bone marrow cells, of course, mast cells, intestinal cells, liver cells, vascular cells. So this is how we see this broad cast of symptoms. Firstly, gastrointestinal. Reflux. The reason why reflux is an important symptom to consider is because histamine will trigger the release of more stomach acid. This is what Peptide C will block, the histamine 2 receptor. By blocking that receptor, you actually decrease levels of acid. Now, some will say, and this is partially true, that Well, reflux is caused by low levels of acid. And that's true for some people, but in histamine intolerance, it's more so that something is triggering the immune system, leading to high histamine, leading to high gastric acid secretion. So that's one. Now, because histamine also affects motility, you can see diarrhea or constipation, in my view, more commonly diarrhea. Also bloating, and as you would expect, food reactivity. In fact, it might be that, and we'll go over some stats in a moment, but 30-ish, even higher percent of those with carbohydrate malabsorption, so let's say you are FODMAP intolerant, you are fructose or lactose intolerant, that may be wrapped in along with histamine intolerance. Coming over to the brain, because histamine regulates acetylcholine, serotonin, norepinephrine, you can see a number of neurological symptoms: headaches, dizziness, insomnia, brain fog, mood fluctuations, and especially the sort of cognitive fatigue. From a respiratory perspective, coming back to the simple analogy of seasonal allergies, runny nose, congestion, especially if you eat and then shortly thereafter or even during the meal, you notice a runny nose. Congestion, sneezing, and difficulty breathing. And then from the perspective of the skin, inflammation, urticaria or hives, itchiness, and flushing, especially flushing of the cheeks, are all demonstrative of histamine intolerance. And then finally, cardiovascular palpitations, racing heart. Because histamine can be either vasodilatory or vasoconstricting depending on how it's impacting the individual, it may cause POTS, which is essentially postural hypotension and low blood pressure. Okay, so then how do we test this? This is something that at the clinic, every once in a while, someone will say, well, I know I have a problem with histamine. I'll always have a problem with histamine because my genetic testing indicated so. This is not really giving the full picture. It's true, there are over 50 total genetic variants that can lead to or perturb histamine levels or metabolism, with 4 main genetic variants. But consider this from a 2004 study. The mere presence of an altered variant, gene variant, would not serve as a diagnostic marker of histamine intolerance. So some, but not all, histamine is dictated by genetics. You can't modify your genetics. What can you modify? In a huge way would be your gut. There's other things that we'll also cover here momentarily, but I just want to paint this perspective that we should not be looking at genetic screenings, in my view, but again, this is based upon the evidence, as the end-all be-all dictating what someone's histamine tolerance is. You've likely also heard, perhaps, of the blood test for that enzyme I mentioned earlier that metabolizes histamine. This is DAO, diamine oxidase. This can be supportive of a diagnosis, but not definitive. Now, looking across multiple trials, what you see is that the cutoff levels to dictate is this diagnostic of histamine intolerance or not range from less than 3 units per milliliter or less than 10 in other studies. So there's a decently broad range. And without getting too into the weeds, you want to have a high activity of this DAO enzyme. But activity and what you see in the blood are actually 2 different things. So it gets a little bit murky, which is why I really appreciate from this 2023 review paper the following quote. Currently, a positive clinical effect of a low histamine diet is the most important for establishing the diagnosis. So this is the home test I alluded to earlier. The nice thing about this dietary change, this test, is that it will be a fairly quick response. Clinically, oftentimes we will see within days the person noting response. And if you're not seeing a response by the second week, then a low histamine diet probably isn't the right fit for you. And I'll come back to some details on the diet in a moment. But I did want to share this one visual that helps illustrate why the diet is so important. This image comes with some minimal adaptations on our part from the journal Nutrients. And what you're seeing is genetics are one factor, which we can't change. The microbiome, which we can modulate, is another factor. Diet is another, and this is a big one, obviously because you're eating multiple times per day, including alcohol. And then certain drugs also have an impact. So what we can modify, diet, drug use, microbiome, and then this final factor here, environmental, malnutrition, and inflammatory factors, again, also highly modifiable, are what underlies or precedes histamine intolerance. So diet, crucially important. Coming to the diet specifically, and this comes from our low histamine diet handout, one of the high levels is that fermented foods are high in histamine. Now, they're also rich in probiotics. And like I've said before, as much of a fan as I am of probiotics, for people with histamine intolerance, obtaining the probiotics through fermented foods might not be the best approach. But looking at the diet here, certain vegetables, fruits, starches are either safe, low histamine, or should be avoided, high histamine. So these are all high histamine foods: avocados, spinach, tomatoes, sauerkraut. It wouldn't be too hard to swap those in for things like kale, as one example, spring mix, squash. And then regarding fruits, most citrus fruits are high in histamine, whereas there's a number of fruits that are lower, like strawberries. Nuts are high histamine. Most dairy is high histamine. Most proteins are low histamine, with the exception, important caveats, of cured meats, bacon, salami, pepperoni, lunch meats, hot dogs, and canned foods like tuna, as just one example, or things like jerkies. And you may remember me mentioning in the past that I had found what I've called the lazy man's paleo diet problematic, because while convenient, it can be high in histamine. And what do I mean by that? Well, for a period, I was eating lots of kombuchas, sauerkraut, jerkies, spinach, avocado. And for someone who has histamine intolerance, as I've struggled with on and off, that diet can actively make you worse. Fats to focus on would be olive oil and coconut oil. Chocolate is a no-no. Let me make one clarification here, because the volume of consumption matters. People will sometimes say, oh, I feel like I threw off the low histamine diet, doc, because I had 2 squares of chocolate. That's fine. Or maybe you're using, let's say, the elemental diet, and you want to use the chocolate flavor over the vanilla. I would have zero reservation about the small amount of cocoa or cacao that flavors a product. Think big picture, large degrees of consumption, small amounts will not really be a dissuading factor. It's what you're doing meal over meal for the bulk of the food that you consume. Alcohol is a problem, including wine and beer, kombuchas, and even caffeine can be a problem. Now, again, right, if someone really enjoys caffeine, I don't tell someone to avoid caffeine, but rather I'd opt for maybe black coffee or with minimal use of sweeteners and maybe a splash of cream, but really trying to use that sparingly. So important to bear in mind that it's not about trying, like with any diet that we talk about, with a few exceptions, it's not about trying to get your consumption down to absolute zero. The one exception might be for someone that has really frank gluten intolerance. They're quite sensitive, but for FODMAPs, for carbs, so if you're trying to go low FODMAP or low carb or low histamine, again, not about getting to absolute zero. That's a recipe for driving yourself crazy, but think about generally and substantially reducing your intake. And we do have this diet guide available with additional context, but this at least gives you a high-level overview of how you can ease your way into flaring your symptoms by consuming high FODMAP or without too much fuss, eat your way to reduce histamine and therefore start the process of repairing your intestine. Oh, and by the way, there's been at least one study that found a low histamine diet over time will actually increase the activity of the enzyme that metabolizes histamine, that DAO we discussed a moment ago, which is a theme we keep seeing, which is the right diet for the individual ends up being healing and reparative. Also, subtext there is meaning you won't have to follow that diet forever, thankfully. So think rehab plan, short-term avoidance, and then you should be able to resume a broader dietary intake or broader activity. One other point I should make here, this is listed in our diet guide. The longer food sits in the fridge, the more histamine it will accrue. Now, does this mean every meal has to be fresh? No, it does not. Could you do a batch cooking one day for that day and the next day? Totally. I think 24 hours is reasonable, maybe a touch over that, but if you're getting to 2, 3, 4 days and you're doing this consistently, then that might be a problem. Again, like with all these rules, would eating something that's 2, 3 days old here and there be a problem? No. But if you did that habitually, meal over meal, day over day, that might become a problem. Now, within the diet, we also want to avoid foods that we know can erode the health of the lining of the gut. Processed foods due to their colorings and their emulsifiers. And then also gluten and dairy. For the smaller subset of people who have true gluten intolerance, yes, but gluten and dairy is probably more likely an issue due to the fact that carbohydrate malabsorption and histamine intolerance are linked. Meaning, coming back to that visual of the lining of the intestines, if the lining is damaged, you secrete less enzymes. This is the case for histamine, DAO, but also lactose, dairy. And it's been shown in both models that the ability to recover enzyme production and therefore reintroduce successfully these foods has been demonstrated, as well as the same thing for FODMAPs. I just try to always continue to paint this perspective that these dietary changes shouldn't need to be forever, because if it's the right change for the right person, that's going to be reparative, reduce your symptoms, and allow you to broaden your diet over time. We've also discussed on the podcast in the past this concept of gut types. And this may give some direction for if you're going to do low histamine, but let's say you've also noticed that you bloat really easily from vegetables, then that may indicate that low histamine, along with a coloring of low FODMAP, is the best for that person. And this is the bacterial type gut. Now, conversely, some people notice they do really well on lower carb, higher vegetable. And when I say carb, what I mean is the really high impact carbs, rices, potatoes, starches, sugary fruits, things like that. So some people notice those high impact foods, starch-rich, sugar-rich foods, do not sit well with them, but they thrive on sort of a lower carb paleo diet. Lots of vegetables, and this would be the fungal types. They need lower carb, a sort of candida diet, perhaps additionally with low histamine. Now, I'm not trying to get into the weeds here, but for those who have histamine intolerance, there's usually something else occurring that's driving it. Histamine intolerance doesn't tend to occur in isolation. It's sort of a secondary effect in the wake of a gut imbalance, as we discussed at the open of this discussion, or perhaps to bring in another factor, nutritional deficiencies. Certain vitamins are needed to function as a cofactor for that DAO enzyme, including but not limited to vitamin C, copper, and B6. And that's what you're seeing in this next schematic from the Journal of Nutrients. There are also hormonal fluctuations, specifically estrogen, that impact the function of that DAO enzyme, which might be why women experience cramping, in part due to the impact of estrogen on histamine. And so the answer here could partially be histamine, but also partially be supporting the female hormones. A big factor for some people is environmental exposure to pollen, to other allergens like cats and dogs, or to mold. Now with mold, you have to be careful because that can be sort of this ethereal boogeyman. Having the pleasure of living in a residence that had visible mold all throughout the HVAC, I can tell you that when there's appreciable mold in an environment, people will notice when they're there, they feel worse. When they leave, they feel better. When they return, they feel worse. That's what you want to be looking for, just to make sure you don't chase your tail, because it is possible in almost any residence to find a speck of mold. A speck of mold is different than something that's, again, going to lead to a noticeable immune triggering. So just keep that in mind. Certain medications, non-steroidal anti-inflammatories, certain antibiotics, ironically, certain prokinetics, certain antidepressants, and opioids can all affect the activity of that DAO enzyme. There are also direct supports that can be used to lower histamine. And I should mention that these direct histamine supports, they should be used secondary to treating what the underlying provocator or cause of the high histamine is. But a few of these, not an exhaustive list. And we're going to do a follow-up podcast that will go into much more detail of the treatments and how to use and personalize those. But vitamin C, careful with that, because if the dose is too high, it may make diarrhea, which is a histamine intolerance symptom, worse. Quercetin, resveratrol. You can use the DAO enzymes directly as a supplement. Probiotics. We've discussed in the past that probiotics in a handful of trials have shown the ability to reduce histamine-mediated disease activity. And then for some people, over-the-counter antihistamines, Claritin, Allegra, and Xyzal. There's also some medications like Cromolyn and Ketotifen that you may want to speak with your doctor about. But I really feel between the environmental triggers, gut health, and the natural supports, we can get really far. And there's one final piece here that should not be overlooked. It wouldn't necessarily be where I start, but if you've gone through many of these that we've listed and you're still noticing symptoms, then a chronic infection of some sort might be the culprit. We discussed previously with Allison Siebecker, SIBO of the nose. So if you notice you have this ongoing congestion, maybe recurring sinus infections, you may want to look into that. A cavitation in the oral cavity of some sort, or just candida or overgrowth or dysbiosis or infection in the oral cavity. And this is where just having a good dentist that you do periodic follow-ups and screenings with can help to rule that out. And I think a big one that gets missed outside of the gut, so in the gut we have candida, dysbiosis, and SIBO, but we're coming, especially of late, to better appreciate this additional layer that eludes some people, which is known as a vector-borne infection or a vector-borne microbe. Historically, these are labeled as Lyme disease. I don't think, and much of the community is no longer using that term, because the Lyme bacteria, Borrelia, is actually less common than a different organism known as Babesia. Babesia, most prevalent, Borrelia, aka Lyme, second most prevalent, and Bartonella, third most prevalent. These can cause chronic stimulation of the immune system and can be part of why some people are continually plagued by low-level inflammation, reactivity to foods. In fact, there was a study by Erdman that found when people had 3 or more digestive or systemic symptoms, there was a jump in the likelihood that a vector-borne infection was present. hopefully this gives you an overview of sort of the multi-system presentation that histamine intolerance or mast cell activation syndrome can lead to, including but not limited to fatigue, brain fog, insomnia, skin rashing, itching, hives, flushing, heart palpitations, low blood pressure. Diet makes a big difference. This can lead to somewhat immediate, oftentimes within the first few days of the diet, relief. Gut health is also a substantially important factor. And remember, the treatment starting points are diet, which would be low histamine, paired with a diet that seems to be tailored to your gut type, bacterial or fungal. So that would be low FODMAP or Candida, respectively. Reducing other environmental triggers, healing the lining of the gut, and this is where probiotics really have multifold utility because they can reduce leaky gut, they can combat SIBO and dysbiosis, and then also either natural or over-the-counter antihistamines. And I wanted to close with this Chinese proverb I came across recently: a little fragrance always clings to the hand that gives the roses. So maybe a reminder to do something nice for someone else, and that typically gives you a little boost in how you feel. And coming back to histamine intolerance, hopefully this helps, and until next time.